Okay, good afternoon, everybody. I'm David Sandman, the President and CEO of the New York Health Foundation, and I'm so pleased to welcome all of you and our guest for today, Dr. Dave Chokshi. Let me tell you a little bit about him. Dr. Chokshi joined the foundation last month as a visiting fellow, and that followed his successful and very high-profile tenure as New York City's 43rd Health Commissioner, where he led the city through much of the COVID pandemic. You probably feel as if you know him. He was a near daily presence in our homes and on our TVs during a massive blitz of public service announcements. Before becoming Health Commissioner, he was the Chief Population Health Officer at New York City Health Plus Hospitals. He's a native of Louisiana, and his career has spanned many sectors, including serving as a White House Fellow and Principal Health Advisor to the Secretary of Veterans Affairs. I know one of the things that he's most proud of is that he continues to take care of patients at Bellevue Hospital. And in fact, he just spent this morning in clinic and then rushed across town and changed out of his Dr. Whites into suit and tie. But if all of that is not enough to impress you, Dr. Chokshi will have another great honor this weekend. Tomorrow marks the return of New York City's famous Mermaid Parade in Coney Island. It's back for the first time since COVID. It's a fun, creative, colorful, only in New York kind of event. And amazingly, Dr. Chokshi has been crowned King Neptune for the parade. So he can add that to his list of accolades, and be sure to turn out for that and join the fun. We have a really big, I'm glad to see you smiling, King. We've got a lot of people on for this event. I encourage you to submit your own questions and comments through the chat box. I'll try to keep an eye on that and work in as many as I can. But we have so much to talk about, so let's dive in. Welcome, Dr. Chokshi. Would you like to start? Would you like to start with any words of introduction?
Well, thank you. I just have to say on the Mermaid Parade, David, a very, very unexpected honor, and of course one that really flows to everyone in public health and healthcare who has given so much over the past 2 years. So, I'm very happy to accept it on their behalf. And there's so much symbolism in it because the Mermaid Parade, for those who don't know, it's New York City. It's this beautiful expression of the diversity of our city, of our commitment to the arts and creativity, and of course, a good time on Coney Island in the summer as well. So, so looking forward to that. And that thank you extends to this conversation as well. I always like to start out these types of discussions with a thanks to everyone who's tuning in, because I know each of you also did something throughout the pandemic to support our fellow New Yorkers. So, so I'm grateful to have the chance to reflect with all of you about that.
Thanks. Well, I see some comments, congratulations, and well-deserved, and a much healthier event than the hot dog eating contest that I think is going to happen on July 4th weekend. All right, so let's talk about COVID, of course. And you know, I know there were a lot of hard days, long nights as commissioner during what, you know, without overstatement, the worst public health crisis in our lifetimes. And we're going to get into some of that. But, you know, I always like to start from a positive place. So I'd love it if you could share with us some of the best moments from your time as commissioner and some of the really gratifying memories that you're going to keep with you.
Thanks for asking about that, David. And yes, you know, I cherish some of the memories, particularly associated with the vaccination campaign, which was such a, you know, no pun intended, a shot of hope, you know, across the city. The first vaccination actually in the entire country was on December 14th, 2021. And, you know, I remember it, sorry, 2020. And I remember it so vividly because it was my father's 75th birthday. And, you know, I was so moved just thinking about what it meant, the relief that I felt that finally, my father would have that protection, and what it meant for so many other families, who would also be able to benefit from it. And I felt that again and again over the course of the campaign. I remember also going to a school as we were fully reopening them in September of 2021, and meeting a father. This was the very first week, and we were setting up our vaccination clinics in schools across the city. I was meeting with some of the families, and the father was there with his daughter, both sort of, quiet in a corner of the room. And I went to approach them and just introduce myself and hear a little bit of their story. And the father told me how meaningful the moment was for them because they had lost his wife, his daughter's mother, earlier in the pandemic. And he almost couldn't get the words out, when he was telling me what it meant to extend the protection of vaccination that he had been able to benefit from to his child as well. So those are the moments that that I really remember. Also, so many examples of heroism, not always on the television screen or in the newspaper, but countless examples of people stepping up, particularly in March and April of 2020. I was at Health and Hospitals at the time, and I saw so many examples of people pulling out all of the stops, working 100 hours a week, not just to take care of patients amid the surge, that we were experiencing, but just taking care of their fellow human beings as neighbors, making sure that people had food because everyone was in isolation, checking on elderly in their buildings. And I think again, I'm grateful that you're asking the question, because as we emerge from hopefully the worst of the pandemic, those are the pieces that I hope we will hold on to. The will and the volition, that represented, our ability to do big things, whether it was the vaccination campaign, or during that first surge, and direct them to the problems that we'll continue to face.
Those are really, moving and personal moments and speak to broader dynamics. When you mentioned the very first vaccination in the US, of course, the recipient of that was a nurse at the Northwell system. And to tout another important New York institution, she's a very proud graduate of CUNY, the City University of New York, which is now running some wonderful ads featuring the nurse and how her education there gave her start. So a lot of New York pride in that moment too. So how'd this all happen? How did you become commissioner? And what went through your mind and your family's mind when you got the call?
Yeah, well, it all came together in the summer of 2020. I had actually stepped down from my position at Health and Hospitals after 6 years. That I was very proud of having served there. And as part of leading our COVID response for the public hospital system, I had gotten to know some of the folks at City Hall in March and April of 2020. Including the mayor, and was part of the team that was helping to craft the city's response, even as I was working on the hospital side. So I think I became a bit more of a known quantity, from the City Hall perspective. And so, I got a call out of the blue. I'll never forget it. It was after I have a daughter who's 3 years old now. So she was only a year and a few months old at that point. And I had just finished putting her down to sleep for the night. And I got a call, and the question, posed by City Hall was, would you be interested in serving as health commissioner? And I have to admit, I thought about it very carefully. I thought about it because I knew what it meant for my family, not just the stress, for me personally, but the sacrifice that it would require of my entire family. and very candidly, I also knew that it meant that I was putting my own reputation on the line. A really challenging environment politically, and so much opportunity to to fail because of the difficulty of what we were going through. But on the other hand, as I talked it through with my wife and I looked myself in the mirror the next morning, the thought that went through my mind was, what had I done all of my training for? If not for a moment like this, to say yes and to step into the challenge, what else would I be waiting for other than a call to service like this? And that became my overriding thought when I went ahead and accepted the position. I didn't know exactly what I was getting myself into in ways large and small. Some of the political challenges were even deeper than I had appreciated from the outside. There were some cultural challenges even within the amazing staff of the health department, that I had to confront. And to give you a little bit of a lighter spin on that, I had no idea that I was signing up for all of those public service announcements. I don't own a television. I had no idea that they would be broadcast as widely as they did during the pandemic. So there was a lot that was completely unexpected about it. And as you've alluded to, it was challenging for me, although pales in comparison to the challenges that so many other families experienced during the pandemic. But now, almost 2 years later, I look back at all of that with mostly a deep sense of gratitude and a fair amount of pride, for all that we've been able to accomplish together. So, so I'm grateful for the call to service, and and I try to be worthy of the job each day.
Well, if you get a glance at the chat box, I think you'll see people are very glad you took that risk, and a lot of expressions of gratitude to you in that box. But you said you didn't know about politics, so let's talk about politics. At the time you became commissioner, very public tension between H&H and the department about roles and responsibilities. And upon your appointment, I was quoted in the media as saying, you were the perfect person to heal that rift, and and that both organizations needed each other. They could not succeed without one another. How did you address those turf battles, and what's the working relationship like now?
Yeah, well, I'll take the second part first. I think it's much better, than when I stepped in. And my approach was really to look at it through the eyes of one of my patients, or a community member, an everyday New Yorker. What I know is that they care about health. They care about their own health, the health of their family. They care about not getting sick as much as possible, avoiding the hospital, avoiding seeing me at the doctor's office. And they also care about having people who care about them available in times of duress, in times of crisis. And so what that means for those of us who are in healthcare and public health is to unite around, the concept of health, to actualize that for the people that we are serving. And so, as simple as that sounds, that was really the abiding notion that I kept in mind, when it came to collaboration, between the health department and health and hospitals. I also benefit from the fact that they're two institutions that I love dearly, that I've held in high esteem for my entire professional career, because I've seen what they can accomplish, particularly when they are given resources and free rein to do, what they're passionate about doing. And so, so that love for those institutions is also, a huge part of what drove me to try to knit us together. I have to pay homage to the leadership on both sides. Health and Hospitals, Dr. Mitch Katz has been terrific throughout the pandemic. He and I had a wonderful, relationship, so we could talk multiple times a day, usually, during the worst of COVID, to stay as connected as possible. So the goal was to create that seamlessness, to look at it just as my patients look at it and say, it's our job to take care of things behind the scenes, so that what we present, whether it's in COVID response or for all of the other slower moving disasters, chronic diseases, the opioid crisis, mental health, that they benefit from the world-class clinical care system that we have at Health and Hospitals and the equally world-class public health department.
Sticking with politics, I think a lot of people have a conception about public health that there should be a, unbreachable wall between science and politics, and it's all about science. Politics should have no role in public health. But I know you've spoken before. You hear that all the time from politicians who say everything I do is going to be, based on science. But you've spoken before that that's just not reality. It's too simplistic, so maybe you can elaborate on that.
Yeah, thank you. And I reject, this idea that we can have sort of pure science guiding our entire public health apparatus. And I know that this may be, somewhat of a controversial perspective, but it's born from my experience, working in a very operational role in a healthcare system, as well as in, health departments, both at the city and the state levels, where I think one of the jobs of a public health practitioner, and particularly for a public health leader, is to understand the political landscape in a way that allows us to take an evidence-based understanding, grounding in science, and merge it with all of the other values that a society cherishes and holds dear, so that we can prevent as much suffering and save as many lives as possible. That's ultimately what I think the job of a health commissioner or another public health leader is. But that requires grappling with the politics, not feeling like we are above them in some way. I want to give a couple of examples so that it's not so abstract. I think about, school reopening during the pandemic, and how much, I personally was involved in this from a basis of the science of what we understood about the spread of COVID in schools, but also with the humility to recognize that in many cases, these are decisions that we have elected our public officials to make, because it's not just based on science, it's also based on all of the other values that come into play when you think about a decision as complex as school reopening. It has to do with the economy, of course. It has to do with the way in which our entire society rests upon a foundation of schooling our children. To me, the most significant public health decisions are all like that. It requires us to bring all of those values together. I do think that, science has a particularly important role to play in driving that conversation, but it's not the only value that we hold dear.
Well, I mean, you're a authentically virtuous person, but the real world is messy, and there was a famously toxic relationship between our governor and our mayor during the pandemic. Just how much of a problem was that for you?
It was a significant problem. There were moments where my frustration at not being able to advance public health policy for New Yorkers could be directly tied to the toxicity of that relationship. There were moments when I was reaching out to the health commissioner at the state level, both Dr. Zucker and then Dr. Bassett, to say, look, it's part of our responsibility to try to take whatever the relationship, between our bosses may be and do what's right, on behalf of New Yorkers. There was a moment, again, during our vaccination campaign when, one of the ways in which the governor and the mayor didn't get along was around authority, who had the authority to do what. So we had a press conference. This was in, late December of 2020. And first responders were among, the first groups to get vaccinated. So the mayor and I at a press conference announced that we were going to start vaccinating our police officers and other first responders. The governor at a press conference less than an hour later said that, the mayor and I didn't have the authority to do that. He announced that at a press conference, and then I got a very irate phone call to let me know in no uncertain terms, that I would be held responsible for breaking state law if we were going to move forward to vaccinate first responders. And it's ludicrous, to think that that's what our public officials are spending time doing instead of sorting things out so that we can actually, move forward with what our responsibility is during a pandemic.
Thanks for your candor on that. Let me shift gears to public health. COVID arrived, and I think it's fair to say we were pretty unprepared. Inadequate surveillance, very limited testing capacity, little contact tracing, shortages of PPE. The list goes on. And how could it have been otherwise? We'd seen decades of disinvestment in public health at a national level, erosion, budget cut after budget cut, personnel, attrition over time. And we paid a terrible price for those decades of disinvestment. So, have we as a nation learned anything? Are we going to be better prepared next time?
I hope so, but there's reason for concern. As you said, we were not well positioned even before the pandemic. We spend less than 3% of the nearly $4 trillion that the United States spends on health, on public health. And at the end of the day, you get what you pay for when it comes to, investment in the basics. We're talking about laboratory capacity and epidemiologists, not to mention community health workers and the safety net when it comes to clinical care. If you would ask me this in 2020, my answer would be a little bit different than it is today, in the sense that even as we were going through the worst of the pandemic, my feeling was that this was so catastrophic that it would jar us into doing things differently. That finally we would recognize, the folly of underinvesting in public health. But now, 2 years later, this is my great worry, that we haven't learned the lessons of COVID-19. I mean, look, it's hard to fathom massive investment in public health when we can't even get a bill to fund the current COVID response through Congress. We're not even mustering enough courage and political will for the current pandemic, much less all of the future ones. So that's why, one of the things that I have been saying in recent weeks is that this is a really important moment in the pandemic. It's no less important than the beginning of the vaccination campaign, or when we first reopened schools. This is a moment that will determine what our lasting and durable response to the pandemic will look like. And we have to, sort of turn back to history to understand the different paths forward that we have here. Very briefly, in the 19th century, we invested in public health after a series of epidemics, yellow fever, cholera. That's how my, former department, the New York City Health Department, came about. And there was a sanitation revolution, that was tied to that understanding. But then in the 20th century, in the wake of the 1918 influenza, the so-called, the Great Influenza, but which was then referred to as the forgotten pandemic because very little changed in the wake of that, seismic event. So here we are in the 21st century, and we face a choice about how it is that we're going to learn the lessons of COVID-19 to be able to respond to the next public health emergency, whatever it may be, but also all of the other things beyond COVID that we know are slower moving disasters.
So if you were the king, pun intended, what are the sweeping societal changes that you would like to see take root because of COVID-19?
Yeah, there are a handful that come to mind. First is, a big part of the story of the tragedy of this pandemic is one of racial inequity and racial injustice. We must contend with the legacy of racism that we saw, in devastating ways. The catastrophic combustibility of historical patterns of injustice, as they intersected with this very infectious respiratory virus. So that's one where making it so that we think about inequity, and particularly racial inequity, as central to everything that we're doing, particularly for those of us who care about health, and not just something that is an add-on, or we have to do the main event and this thing about equity. That's one big piece of it. There are a few others, but for the sake of brevity, I'll just name one more. And that is, the notion that the psychology of prevention is something that we need to talk about more explicitly in health and reckon with, to be able to raise the capital, the funding that's necessary for things like massive investment in public health. It's always easier to fund cancer treatment compared to preventing cancer. And we actually have to figure out better ways to talk about that in public health if we want things to change.
Yeah, thank you. Let's stay with racial equity because it is so important. Obviously the hugely disproportionate effects on people and communities of color early in the pandemic, and infections, hospitalizations, deaths came as no surprise to those of us in the field. We see it on virtually every health indicator, but it surprised people, became impossible to ignore, maybe if you're not in the field. And we stepped up, right? I think it's fair to say that New York City leaned in very hard on the vaccination campaign, to use an equity first approach. I think that's fair and a big credit to the department and the city. And yet, despite all of that, Omicron came. We saw New Yorkers of color still hospitalized at much higher rates. So, what went wrong?
Yeah, well, we have to do more, is the beginning of the answer here. There is much that we attempted to do, over the course of the pandemic, particularly in New York City, and with the vaccination campaign, as you pointed out. We made sure that it was a race explicit approach, that we were able to have sufficient quality of data to understand how we were actually doing when it came to closing the gaps, with our performance in the vaccination campaign. We also tried to bring to bear enough humility to say this is not something that government, can solve alone. And so we ended up channeling a lot of our resources and investment, and I have to thank you and the New York Health Foundation for supporting our Vaccine Equity Partner Engagement Initiative, which flowed funds to community-based organizations because they are more trusted in the communities that we were trying to serve. But at the end of the day, if you really care about racial equity, you have to look at the numbers and the outcomes. And what they showed is that we did not succeed to the degree that we needed to. And for that, we have to get to some of the the underlying structural factors. The fact that the racial wealth gap should be considered a public health issue because of the ways that it has ramifications for an individual's and a family's ability to to survive a health catastrophe. Those are things that we need to continue talking about and thinking about ways to actually get to the core, the root of the issue when it comes to racial equity.
Well, I mean, it's everything, right? I mean, we could put it under social determinants of health, but part of it is people of color were more likely to be essential workers, without the luxury of working from home and had higher risk of exposure. Their reliance upon transportation poses a risk. The type of perhaps more crowded or lower quality housing, everything layered on top of everything, right? Including, of course, access to medical care and pre-existing conditions. So,
yeah, that's very well described, and there's a cascade of factors from the proximate to the more distal that all tie to make these these horrific outcomes, these outcomes that we should be appalled by and embarrassed by because they're happening on our watch. And there's another piece to this that we have to mention in this conversation around addressing racism and particularly challenging white supremacy, which is that this has costs for everyone. It's appropriate for us to talk about the costs that are borne specifically by people of color and communities of color. But the fact that we have not contended with our legacy of racism in the United States and in New York City is part of the reason that we're not making investments that affect and can improve the lot of all of us. This is the argument that Heather McGhee articulated so well in her book, The Sum of Us, and which has really been reverberating in my mind as we think about what is necessary to rebuild our foundations, whether it's talking about, why are we not having a full-throated conversation about universal coverage, and Medicare for all, even as we saw how devastating it was for people to go without health coverage, during COVID-19. Those are things that if you peel back the layers and you keep asking the question why, you contend with that idea that we're not actually discussing it in a way that connects racism to our ability to invest in the things that we really need.
Thank you. We obviously need to spend a lot more time on this. Let me bring another dimension of COVID in, and then I want to broaden our conversation. Information, or probably more accurately, misinformation. Partisan politics, conspiracy theories, misinformation blossomed during COVID. Gets amplified so quickly and powerfully online as a massive echo chamber. How did the department monitor misinformation, and what did you do to try to counter it?
Yeah, another lasting lesson, of COVID response, and one that we have to continue evolving our approach to. Just briefly, this was something that we identified early on in COVID response as a gap, frankly, within our public health response infrastructure. When I got to the department, we didn't have any dedicated staff. In our truly amazing team of 7,000 people, there wasn't one person who I could point to and say, it is your job, to architect the department's response to misinformation, and let's not leave out disinformation, which is deliberately created falsehoods, that end up being spread. And so we started modestly, a group of 4 people within our emergency response structure. And we created the first ever, I believe, misinformation response unit within a public health department. We applied the tools of what is sometimes called infodemiology. It's taking the ideas, the concepts of epidemiology and addressing and applying it to the information ecosystem. And so we built an approach that was rooted on surveillance. So I would get a weekly report of the misinformation that was circulating in New York City, including across social media and in different languages. The second part of it was response. What do we do to actually combat that? And usually in a more proactive way than just trying to rebut that misinformation and disinformation. And then evaluation, which is of course the linchpin of any public health intervention. How well are we doing in our intended response? So we created that loop and we tried to iterate on it, over the course, particularly of the vaccination campaign. But I think the broader application here is that addressing misinformation and disinformation should be considered a core function of public health going forward, because we have seen its effects on health and frankly on people's lives. And so this is an area where I think there has to be some innovation that needs to be supported and needs to be tied to bread and butter public health activities.
We could talk about COVID, all day, all weekend, all month, but I want to get to some other things. So let me ask you one more COVID question at least, and just looking forward. And I know predictions about this virus are risky and hugely uncertain, but nevertheless, what do you think we can expect? Are we going to keep seeing, these surges as new variants appear and, it's extremely risky and tumultuous? Does this get normalized like the flu, where we get occasional boosters? Even if you get sick, you'll probably be okay, and we mostly go about our lives as usual. Where do you think we might end up?
Yeah, look, I'll preface it by saying, David, I've been wrong so many times in my predictions.
That's an unfair question, I know, so unfair.
But so any answer I give with very genuine humility, having been wrong so many times. With that said, I do hope that we are through the worst of it, but that doesn't mean much, especially in New York City, right? Not returning to March and April of 2020, there's still a huge, range of tragedy and potential suffering that we need to work hard to prevent and mitigate as much as possible. I don't think that we've seen the last surge in New York City. I think that particularly as we head into the fall and the winter, I'll be much more concerned about it. And, take with a grain of salt anyone who claims to know what will happen with certainty. The number of factors that go into this, calculation: waning immunity, the rate of evolution of the virus itself, what will happen with respect to, our ability to have better tools on the horizon, like what's called a pan-sarbecovirus vaccine that actually takes care of multiple variants at once. These are all things that will determine what the future holds. But what I worry about the most is that because of our human fallibility, because of our limited reserve and ability to contend with these major societal disruptions, that we're just not going to have the will to avert as much suffering and illness and death as we could. And so that's what I hope each of us will keep front of mind, because I don't think we're at the end of COVID by any means.
No, I hear people talk about it as if it's in the past tense, and not at all, unfortunately. But let's springboard into some other things. Probably felt like 24/7 or more for COVID, but what else was part of your legacy as commissioner?
Yeah, well, this is, I always have to acknowledge that this is really the health department's legacy. So much of what I was privileged to move forward as commissioner built upon years, or in some cases decades, of work that has been stewarded by so many people at DOHMH. Some of the things that I'm proudest of are a historic Board of Health resolution on racism as a public health crisis. We were very deliberate in using the word resolution, moving beyond the idea of a declaration to signify that we had to go from identifying the problem into actually taking specific actions to redress racial inequity. That was one. A second, which you're very familiar with, is our work on addressing the overdose crisis, including through a harm reduction approach, such as overdose prevention centers. We launched, of course, the first 2 publicly recognized overdose prevention centers in the United States. And that's something that we have to continue to build upon and grow. And the last one, that I'll mention is the public health core, which was a landmark investment in what I think of as the public health workforce that we should have had before the pandemic. One that is community-based, people coming from the neighborhoods that they're serving, and that is on the ground, that is primarily lay health workers with lived experience who can create the connective tissue that's missing in our health system right now, and can leap into action for whatever the next health emergency is, but also address chronic disease and mental health and substance use disorders, because those are crises for so many people right now.
Well, those are such important and enduring achievements. I really try to avoid using the word silver lining about the pandemic. There's so much suffering and death and pain. And yet, all of those things were in part made more urgent and motivated by the pandemic. The overdose crisis is the worst it's ever been. It was pushed from the headlines by COVID, but it is an enormous point of pride for New York City to be leading the nation on overdose prevention centers. The elevation of the discourse around race and health, must be an enduring, legacy as well. Building our workforce. I mean, those are positives that did spring, at least in part, from the pandemic. So I think we can take some comfort, at least, in that. I know you like to describe yourself as a primary care doc with a public health heart, which is really beautiful. Often medical care, public health, they live in different orbits, and you've managed to straddle those. How do we, other than yourself, how do we connect those two and make the sum better than its parts?
Yeah, well, it's a tremendous privilege to get to see patients. And, there's not a clinic session that goes by, including this morning, that I'm not moved by one of my patients' stories. And it makes me think more deeply and carefully about the fundamental drivers of health. And I think that's the space where healthcare and public health really have to intersect, is in common cause around understanding and then affecting those drivers of health, which we sometimes jargonize as the social determinants of health, but which are really the things that, if you ask again an everyday New Yorker, they know that it's housing and education and income and wealth and employment, and the quality of our schools. Those are the things that really shape our our health in a way that allows us to live our most fulfilled lives. So that's the sort of the content of the intersection between healthcare and public health. Where it hits the ground and gets very real is I think in primary care, and extending primary care by connecting that community-based workforce in neighborhoods to the healthcare system. I think about it as the patients we see and the patients we do not see. For every patient that crosses my threshold in the clinic, there are 3 or 4 who never make it there in the first place. And that's where healthcare and public health can come together and create a more seamless experience of health and care.
Oh, that's great. Time is flying, so I want to at least squeeze in, a handful more. as I said, you spent time at the VA earlier in your career. And, I think for a lot of people, the VA gets a bad rap, has a bad public image, has a clunky, terrible old bureaucracy. And that's not true. All the data shows us, and reality is that the VA often provides care of equivalent and even better quality than the private sector. That's the facts. So what can the VA teach the private sector and vice versa?
Yeah, well, I was regularly blown away by the data, that I was exposed to when I was working at the VA. Quality of care, as you mentioned, but also, patient experience when it comes to the experience, particularly for veterans who had specific issues, whether it was post-traumatic stress disorder or a spinal cord injury or exposure to Agent Orange and the burn pits, as a result of their military service. And so, I think that the major lessons that the VA has for the rest of the health system is how to both uphold the quality of care that comes from that very specialized, set of interventions for, specific things that the VA might be best at, but then tying it to a much better coordinated system than the fragmented, default system of American healthcare is. So those are the major things that that come to mind. The other note that I just want to sound on this is that when it comes to the social determinants of health, the VA was doing this before we even really talked about the social determinants of health, right? It's not just healthcare that's provided through the Veterans Administration. It's also jobs, benefits, and housing. And so there's both a reality and also a huge opportunity in creating a health system that's organized around those fundamental drivers of health as well.
Absolutely. Food security as well, absolutely, at the VA. Yeah, well, we couldn't agree more. It's always been our position that, that again, listening to veterans themselves, they want, need, and deserve access to a strong and high quality VA, and they want community-based care options. They like to mix and match. And, it's a false binary choice between one or the other. I probably got to like half of the questions that I prepared. So let me wrap with this one. I know that you speak with your successor, our current health commissioner, on a regular basis, and without breaking any confidence, what kind of advice do you offer to him?
Yeah, well, look, I have tremendous respect for Dr. Vasan, and I've really admired the ways in which he's speaking on mental health and the directions that we need to go. He's termed it the second pandemic because of the experience of so many people and families as we continue to emerge from COVID-19. So he's not in need of advice from me, but what I'll share is that what I tried to keep in mind when I was health commissioner was what a unique opportunity it is, not just because of the tremendous staff at the health department, but because of the pulpit that it provides to move forward the public dialogue on the issues that matter most. Right now, that has to be matched up with the call for not incremental change, but bold, moves forward in the way that I, had thought in 2020 would be the natural sort of follow-on to our collective experience of COVID-19, but which we cannot take for granted right now. So if ever there is a choice between incremental improvement, which is often more feasible, as we well know, and bolder change, I think that this moment calls for those bolder steps forward.
That was very well said. As an expression, our crisis is a terrible thing to waste, and I don't think we want to go back to the way things used to be, because it wasn't nearly good enough. Like, this is an opportunity to truly build back better, and we have to be realistic about it. I think we've had a very realistic conversation today. But we could aim a lot higher than just getting back to normal, because that was not getting the job done for us. This was terrific. There's a lot of love and gratitude in the chat box for you and your colleagues at the department. I hope you have a chance to read through those and put a smile on your face too. We have to leave it there for today. I want to thank all of you for joining us on this session. There's always a lot going on at the New York Health Foundation. I'd encourage you all to visit our website, join our mailing list. And if you really want to keep up with me and the foundation on Twitter, you can do so on the regular. Check out the chat box there. I think they're putting up our website as well as the Twitter handles for the foundation, myself, and Dr. Chokshi. And we'll follow you back, because love is love. So thank you to our visiting fellow, Dr. Chokshi, today. Thank you all for joining us. Again, if you want more of Dr. Chokshi and you're looking for something fun to do this weekend, take yourselves out to Coney Island for the Mermaid Parade. I'll see you there. And to all of you, take care, have a good weekend and stay healthy. Thank you.
Thank you, David.